Hi everyone, welcome to Module 7. This week we're going to be talking about the relationship between physical activity and mortality. So most of the research looking at mortality, which of course is death, looks at all-cause mortality as the outcome of interest. This is just like it sounds, mortality that comes from any cause. So that could be anything. That could be a variety of diseases. That could be cardiovascular disease, cancer, stroke, etc. Or it could be accidents. It could be suicide, all kinds of causes. Sometimes they also look at cardiovascular disease mortality or mortality from some specific cause. But by and large, all-cause mortality is the outcome of interest. And almost always a cohort design is used. If you think about a cohort design, you pick a group of people and follow them over time. And in the case of mortality, you watch who lives and who does not. A case control study is possible in some ways. In some situations, you would look at people who are living and people who have died, but you have to, if they've died, you have to have some way to look backwards and see what their physical activity was like. And so you would have to have that recorded in some way. And therefore, a case-controlled design is pretty difficult. So first, let's start off with what is the average life expectancy. This varies for males and females, and it varies by which part of the world you live in. So for men, men living in Iceland have the longest average life expectancy in the world, and that is just over 80 years. And you can see all the way at the bottom, men in the United States live on average 75.6 years. And then there are quite a few countries in between, number one in the U.S. Women live longer than men on average. Japanese women live the longest, an average of 86.1 years. And then again at the bottom, you see that the average woman in the United States lives 80.8 years. So everybody dies of something. What do they die of? It depends on their age. But if you group everyone together, all ages, heart disease is the number one killer. 26% of all deaths are from heart disease, followed by cancer, and then cerebrovascular disease. That is, the cerebrum refers to the brain, vascular to the blood vessels. So this is essentially a stroke. But then if you separate further by age, young people 5 to 14 are most likely to die of accidents, followed by cancer and then birth defects. And then 25 to 44-year-olds are also most likely to die of accidents, cancer, and then heart disease. And then the oldest group of Americans, those who are most likely to die overall, they typically die of heart disease, cancer, or stroke. So the question then is, can mortality be affected by lifestyle and behavior? Of course, we know the answer is yes. For example, smoking, diet, physical activity, exercise, stress, we all are aware that those things can impact our health and therefore our risk of mortality. So what I want to do is talk about the relationship between being physically active with mortality or risk of death, but I also want to talk today about not just physical activity, but also about sedentary time and about fitness. We've defined all of these last week, and now it's time to talk about how they relate to our outcome of interest, which this week is mortality. So remember the 2008 physical activity guidelines for Americans say that we need 150 minutes per week of at least moderate intensity exercise. So if you look on this x-axis here, this is the minutes per week of moderate or vigorous intensity physical activity. So right in here is where people who meet the physical activity guidelines would fall, but they've set the relative risk, the kind of the baseline value or the reference, as about 40 or 50 minutes per week. I can't tell exactly. But as you can see here, doing more physical activity is associated with a decreased relative risk of mortality. So this is probably not surprising to any of you. The risk of dying prematurely declines as people are more physically active. On the x-axis is physical activity in kilocalories per week. So if you get less than 500 kcals per week of physical activity, then that's the lowest group, and all the way up to 2,000 plus. And so you see this nice stair step. That would be a dose response in terms of the causal criteria. The more physical activity you do, the lower the death rate. Now I want to talk about a few different studies that were used to look at the relationship between physical activity and mortality risk. These are all cohort studies. This study in particular was used to assess the relationship between occupational or work physical activity and risk of mortality. So this is the U.S. Railroad Workers Study. We talked about the London Transport Study earlier in the semester, and this is very similar, but they studied over 190,000 men who worked in the U.S. railroad industry. They had to work in the industry for at least 10 years to be in the cohort. They were classified by position. There were 3 possible positions, either clerks who had sedentary jobs, switchmen who were considered active, or section men or the most active. And what they did was they considered these to be 3 separate groups, and then they adjusted for age and found that the death rates for sedentary workers was 11.7, for active workers it was 10.3, and for the most active workers it was 7.6. So they did find an effect of occupational physical activity on mortality. However, they didn't have any data on potential confounders, so things that are also related to risk of death and possibly to their position. So smoking, BMI, blood pressure, cholesterol, and so forth. So because they don't have that information, it's a little bit suspect, but it's still likely that occupational physical activity decreases risk of mortality. There are other studies on this that show similar findings, but the data for occupational physical activity isn't as strong as it is for recreational physical activity, and that's what we're going to talk about next. So this is physical activity for leisure or recreation. We've mentioned it before, but it's a really important study, so I want to talk about it again. The Harvard Alumni Study. There were over 21,000 male alumni of Harvard University. They were undergraduates between 1916 and 1950. Only males were included because Harvard did not admit women prior to 1950. And so there were no women alums. So what they did is they asked these alumni about how many flights of stairs they climbed daily, the number of city blocks they walked daily, and the types of sports and activities that they participated in and for how long. They were able to adjust for some possible confounders, so they adjusted for age, smoking, BMI, blood pressure, and the age at which their parents died, so it's a kind of a way to adjust for heredity or genetics. And what they found is that the active men could expect to live 2.15 years longer compared to inactive men. So basically you can add just over 2 years to your life by being physically active. And that was found to be true up to age 80. So both of the studies we've just talked about looked at men, so there was a lack of information about women. So the Iowa Women's Health Study was done, and they looked at 40,000 plus postmenopausal women, so a little bit older. Postmenopausal women tend to be in their 50s or above. Not all, but most. They were women living in Iowa. They were ages 55 to 69 at baseline. And they were classified as having a low, moderate, or high activity level. They classified high activity as women who reported doing vigorous intensity exercise or activity twice a week, or moderate activity 4 times a week. So they didn't even have to meet the physical activity recommendations to be considered highly active. But they adjusted for a whole host of potential confounders. Age at menarche, age at menopause, age at first live birth, parity, that's how many children a woman has, alcohol intake, total energy intake, cigarette smoking, whether or not they took estrogen therapy after menopause, BMI, waist to hip ratio, education level, marital status, history of hypertension or type 2 diabetes. So they adjusted for everything they could think of that might impact death rates, as well as be related to physical activity. And what they found is that moderate activity had a relative risk of 0.77 and high activity had a relative risk of 0.68. So being highly active, and again, their definition of high activity was a little weak, but doing vigorous intensity twice a week or moderate intensity 4 times a week was associated with a 32% reduced risk of mortality compared to doing nothing. So far, we've talked about the relationship between physical activity and mortality, and being active has been shown occupationally and recreationally in men and in women as decreasing risk of death. So the next question is, what about being physically fit? We talked just about physical activity. Now let's talk about being physically fit. This study is from a paper published in 1999. It's a very famous classic study. They looked at people who are fit or unfit, and then they also classified them as lean, normal, or obese based on their BMI. And so your reference category here is 1.0. That's the lean and fit group. You can't see a bar here because it's exactly at 1.0, but this is your reference category. And then so a bar that comes above this line means that their relative risk is increased, and a bar below that line means the relative risk is decreased. So this group is unfit but lean. So they're thin and unfit, and their relative risk is more than twice that of the lean fit. So just being unfit doubles your risk of mortality, even if you're thin. The best category to be in is to actually be normal weight and fit. You actually have a relative risk a little bit lower than 1.0. And being normal and fit has a relative risk of about 1.75. This is probably the most interesting right here. These people are obese but fit, and their relative risk is about 1.2. So it's only 20% higher, even though they're obese. And if you're obese and unfit, your relative risk of all-cause mortality is 2.5. So obviously this is the worst category to be in. The difference here between this group and this group is stark and indicates that being fit is very important for your health, especially if you're obese. But it's really true even if you're not obese. This shows something similar, just shown in a little bit different way. So unfit here, and this is somebody with a BMI of at least 30. So these are obese people. These are normal weight people. And so if you're unfit, it's not good regardless of your BMI. But actually, look, the overweight people who are unfit have a relative risk of 1.6. The normal weight people who are unfit actually have the highest risk, and that's kind of surprising. But it's actually worse to be unfit, according to this data, if you're normal weight. The relative risk was greater than 3.5. And then if you're fit, it doesn't really matter what your BMI is, your relative risk is right around 1.0. So how do they study this? Fitness and mortality risk. The data from the two previous slides are from the Aerobic Center longitudinal study. It's sometimes called the Cooper Clinic longitudinal study, the CCLS or the ACLS, either of those. They studied over 25,000 men and 7,000 women. The study is based out of the Cooper Institute, which is located in Dallas. And what they do is they have participants come in and complete all kinds of health testing, including a graded exercise or VO2 max test where they exercise to exhaustion. And then based on the results of that test, they're broken into quintiles of 5 groups. So the bottom 20%, 20 to 40%, 40 to 60%, 60 to 80%, and the top 20%. And so the lowest group, the least fit group, they have a relative risk of 3.44 compared to the top group in terms of fitness. So if you're in the low fit group, you're 344% more likely to die than are men who are in the most fit group. Another study that's looked at this is the Veterans Affairs Healthcare System Study. This study was specifically used to look at the relationship between fitness and mortality in blacks because most of the data was done in white populations. So they studied about 6,700 black and 8,900 white men who received medical care at the Veterans Affairs hospitals in Washington, D.C. and Palo Alto, California. And when they looked at the data, they found that each 1 MET increase in peak exercise capacity, this is just we're not going to talk about what METs mean because it's really not the scope of this class, but it's just a unit of exercise intensity. So for each unit increase in exercise intensity, they had a relative risk of 0.82, so a dropped risk of 18%. So if you're more fit by 1 MET, then your risk dropped by 18%. Most importantly, the numbers were very similar whether they looked at blacks or whites, and so this showed that the effects seem to be the same regardless of race. Next, let's talk about sedentary time. So we mentioned last week that sitting or sedentary time can be an independent risk factor for disease, independent from physical activity. So physical inactivity is bad for you, but sitting is also bad for you, or so it's proposed. So this study looked at people who sit, how much they sit, and their risk of death. But this is a little bit different. So this is a cohort. They followed everybody from this time point, 2 years, 4 years, 6 years, and so forth. And what you see here is a survival curve. So these are the percentages of people who are still alive at each time point. So if the line is pretty flat, most people are surviving. If the line is pretty steep, more people are dying. So people in the study classified their sitting time as they sit almost none of the time, a fourth of the time, half of the time, 3/4 of the time, or almost all of the time. And you can see there is a very strong dose response here. Almost none of the time has the flattest line, a fourth of the time has the next flattest, half the time, 3/4, and then the steepest line is those who reported sitting almost all of the time. So sitting appears to greatly increase your chances of dying or decrease your chances of survival. And then one other important question is, what about exercise intensity? We've talked a lot about the amount of exercise, but does the intensity of the physical activity or exercise matter? And so this data is showing the relative risk of developing coronary heart disease. This is not mortality, but it's the closest I could find because it's not studied very well. And so what they did was they looked at the absolute intensity of sports or recreational activities. So those who did none or light, and then here moderate and here vigorous. So you can see that moderate, there was a 6% reduced risk of heart disease, but the confidence interval includes 1, so that's actually not a statistically significant decrease. But the vigorous intensity, there's a 26% reduced risk, and then the confidence interval does not include 1, so that's a significant decrease. So what this is showing is that vigorous intensity is more effective than is moderate intensity at decreasing risk. And then if you look at self-rated intensity, so when you ask people how hard do you think you exercise, if they said moderate, that was not significant. If they said somewhat strong, though, there was a 36% reduced risk, and if they said strong to maximal, it was a 40% reduced risk. So all this together, I would say, suggests that the intensity does matter, and that more intense is more effective at reducing risk. So it's a fairly short lecture this week. You will have your quiz as normal, quiz number 7, and then there's a discussion this week for you to think about, post on, and then respond to the comments of your peers.